Hi, I'm Dr. Wilhelmina Lewis. I have the honor of serving as President and CEO for Florida Community Health Centers. I've been in Fort Pierce for over 19 years as a family physician and geriatrician. The COVID-19 vaccine is safe from everything we've seen in research so far. Yes, there are a few mild side effects, and lately we've been hearing a little bit more about some very, very rare serious side effects with one of the vaccines, but overall, the COVID-19 vaccine is very safe, and I urge everyone to take one. Yes, the COVID-19 vaccine is safe for the Black community. We've actually seen with this vaccine that African Americans have been involved in the testing even before the vaccine was released. And what's more, an African American woman was involved in the development of the vaccine. COVID-19 vaccines cannot give you COVID-19. They don't have COVID-19 live virus, and they cannot, again, give you COVID-19. The side effects of the COVID-19 vaccine are usually very mild. Most commonly, people will get some soreness at the site where they got the injection. They may actually have some arm soreness, and sometimes they'll have some headache or body aches. Some people will experience a low-grade fever for a couple of days, and you can actually take Tylenol or ibuprofen for these if you usually take Tylenol or ibuprofen. The COVID-19 vaccine is available for free, both from the St. Lucie County Health Department and Florida Community Health Centers. You can also find it at many local pharmacies. Your local doctor may also have access to the vaccine. Sometimes at your doctor, you may have a small administration fee. The COVID-19 vaccine thus far does guard against the new variants that are circulating. It's really important, though, that people get vaccinated as soon as possible. As the variants continue to circulate, there's a greater likelihood that they may become resistant, and so we want to make sure that people are vaccinated before that has a chance to happen. Even if you've already had COVID-19, you should still be vaccinated. Once you have COVID-19, you'll have antibodies that last in your system for about 90 days. The COVID-19 vaccine, however, will give you antibodies that protect against different variants of COVID, and they'll also make sure that you have antibodies in your system for even longer. The fact that the J&J vaccines were halted shows us that the system works exactly the way that it's supposed to. Unfortunately, 6 people out of the 7 million people who got the J&J vaccine did wind up developing blood clots. This is a very rare condition, and it doesn't happen with the Moderna or the Pfizer vaccine. So again, it shows us that the system works the way that it should, and when people have any side effect, they should report it. Unfortunately, one of the myths that I hear about the COVID-19 vaccine is that it's an attempt for the medical community to experiment on the Black community. I understand why sometimes there's a tension between the medical community and the Black community because of our history. But I do want people to know that what's important right now is that we're actually trying to draw attention to the fact that COVID-19 impacts African Americans disproportionately to other communities. And it's not an attempt to experiment. Because of the hard work that people have done to bring attention to the need in the African American community to be vaccinated, now there's more of an opportunity, and I don't want us to miss it out of fear.